from Dr. Derya Unutmaz. He's an immunologist, a great word, at the Jackson Laboratory in Farmington in Connecticut. Always great to have you on the show. Now, how important is this new revelation?
Well, first of all, this is not something new. We've known for several months that the virus can spread from air. It's another mishap from WHO. It's really very puzzling that it would take them this long to admit that this is a possibility. So there are scientific cases where we've known that the virus can actually circulate in the air for up to an hour, maybe longer. For example, there was a case in China where in a restaurant, people who were sitting at least about 10 meters away from the person who was infected also got infected, and it turned out that the virus was actually circulating in that closed environment.
Sorry to interrupt, because what you say, I mean, we were talking about this before in the newsroom. Why has it taken 239 scientists to raise the alarm with the WHO? And why does it always seem that they are on the back foot with the coronavirus right now?
Yeah, we are lost with words. I mean, it's been going on for since the beginning of this pandemic that they've just been following behind and making announcements that are simply not true. They started with the masks and human-to-human transmission, and now this latest situation. It's really hard to fathom why WHO is so late in these responses.
All right. What I like to do is to understand things very clearly. Help us understand then this from the science from you. If we speak, sneeze or cough, there are large particles which can fall to the ground. But now this information concerns smaller particles that can stay in the air. So how long can they stay in the air, and where is my audience the most at risk?
Sure. I mean, obviously, our knowledge of the virus spread has been growing exponentially since it began. But from the beginning, we knew that the virus was spreading from human to human through sneezing or, even loud speaking, because it all depends on how much viral particles you emit from yourself. And that also depends on whether you are one of those so-called super spreaders, because not everyone will actually spread or release a large amount of viruses. There are certain individuals who can even be asymptomatic and still spread this. So every time you talk, especially if you talk loudly or if you're singing or yelling, even just a regular talk or even taking breathing in and out will release some of these particles from your mouth. And within those particles, these are small, what we call aerosols and small droplets, if you like, the virus is preserved and it can circulate around the air if it's a closed environment, if there's a certain air conditioning system that just circulates the virus for a while. So this is a knowledge that we had already. But it should be, we should clarify that airborne does not mean that the virus all around us. So I think people shouldn't be scared to go out or in open environments, because the virus cannot survive for very long. It just spreads too thin and it disperses and disappears. But in a very close contained environment, and especially if there is one of those super spreaders, it's very likely that it will contaminate others. Hospital environments is a very important source for that, because the patients there are producing tons of virus. And so the doctors, even some of the doctors who have been using masks, got eventually infected because of the high viral loads in that environment.
So, Dr. Unutmaz, your advice to our audience?
My advice is that in any closed, if you can stay away from a closed environment, you should definitely stay away. Restaurants and bars and other such places are still one of the highest risk environments. Even if everybody wears a mask and there's social distancing, you still have some risks there because it only takes one person to not obey the rules. But if you have to, of course, everyone should wear their mask, and that drastically reduces the chances because actually the primary purpose of wearing a mask in that environment is to prevent someone who is infected from infecting others. Because if I wear a mask and if I'm right now talking, the amount of virus that will be captured by the mask is going to be a lot. And so very, very few will actually pass through that. So I'm actually protecting others by wearing a mask. And so that reduces the chance of having enough viral particles in the air. And of course, it's very important that the air circulation is done in such a way that it doesn't circulate within the room for prolonged periods of time. These are the things that we can do to reduce the risk.
Thank you so much, Dr. Derya Unutmaz. Always a pleasure to speak to you. I always learn so much with you. Thank you.